The CDC is expected to loosen its isolation guidance for those who test positive for COVID, as long as you don't have a fever and the symptoms are mild. This news was reported by the Washington Post, and national health reporter Lena Sun joins us now to discuss it. Lena, you've spoken with some federal health officials. What prompted the more lax advice?
So this loosening is something that has been underway and under discussion for about since August. And I think what it does is it takes into account the changing COVID landscape. People have much more immunity from vaccination or infection or both. And also, I think the CDC realizes that people were not following this guidance in the first place, and it would be better to issue more practical guidance that people can accept. And finally, the virus is not gone, but hospitalizations are down. People are not getting as sick. It's much less severe disease. And I think there is the lesson here that when you issue guidance, it has to take into account the societal impact and the disruption to work and school. Many workers do not get sick leave. They can't afford to stay home. And so what's happening is people are not testing, and because they don't want to test positive. So I think those were all factors that played into this.
Exactly, and I think those are the factors that are causing people to feel at least a little bit of relief, but certainly not without responsibility, because you do have to do something if you feel like you might have COVID.
Right, and it's not to say, I mean, the science has not changed. So you could still be infectious in those days after you test positive, even though you are feeling better. And it's important to know that. And it's important to also take into account who you're going to be around. If you're going to be around people who are high risk of getting severe illness, people over 65, people who have weak immune systems. You know, the idea here is that CDC was trying to put this guidance under sort of one umbrella, pan-respiratory, and sort of give people the same kind of guidance that they do for flu and RSV. And for flu, for example, they tell you 24 hours after your fever breaks and your symptoms are improving, you're okay. But we have to remember, COVID is still different from flu. You don't get long COVID from flu. You get long COVID from COVID. And the more times you're infected from COVID, the greater your risk for long COVID, which is very, very bad, as you know.
And I know in talking with some of the doctors here, they were saying that that was potentially why they waited after considering this guidance maybe in August, because they weren't sure about that sort of the flu, RSV, COVID, and worrying about how they're all going to come together when we're not in isolation like we were during the pandemic.
Right. And I think, COVID is going to be with us. The virus is not going away, and people still need to factor that in as they go about their lives. But I think at the same time, public health has to realize that you need to give a message to people that takes into account the science and also what's happening in society. And if you do that, maybe people will be more likely to listen to you and then actually test when they do need to test, so they can take the antiviral Paxlovid and take other measures to protect themselves and their communities.
All right, so you are reporting that this may happen. Do you have any insight as to when it may become official?
I'm reporting that this is under discussion, and I am reporting that it is moving in a way so that it will some version will be released in April. I think when anything like this is taking place, discussions are underway, the White House has not signed off. That timing may move, but that is the plan, and that they have been working on this since last August. They had to pause it, and now they've brought it back, and they are going to, that's what the discussion is moving forward. And so there are pieces we don't know, right? Like, what are they going to say about masking? And will there be more specific targeted guidance for folks who are at high risk? So
I think that masking question is a big one. Thanks for staying on top of this. Washington Post national health reporter Lena Sun, we appreciate you being here.
Thank you for having me.